I'm excited to see all of you bright and early on a Friday morning. So first, I want to thank the Kinder Institute, our colleagues there who helped to co-sponsor this event, and all of the hard work of their staff. I'd also like to thank our events department, who every event do an excellent job in bringing all of this together. And a special thanks to a research associate who works very closely with me, Tara Blogg, who really did an amazing job, coordinating the speakers and all the behind the scenes that make events like this possible. And then lastly, for Brenda Lamance, who is the administrator for the CHB. So if you'll join me in just thanking them and bringing us all together for today, I appreciate it. So my name is Keonta Moore, and I'm a fellow in child health policy here at the Baker Institute. I'm thrilled that you could join us today. This event really came out of questions that I had, and honestly still have, related to a project that I'm doing in an urban neighborhood in Houston that is facing gentrification. We've partnered with a community organization, Sankofa Research Institute, to conduct a comprehensive needs assessment in this neighborhood. And it includes a variety of things: physical, mental health, and then all the social determinants of health, including transportation, income, employment, etc. As I was reviewing the preliminary data, it became unclear to me whether some of our findings were related to gentrification itself, or if they were what you would expect in a low-income neighborhood that has perhaps poor housing stock, or unemployment, or other issues that we know affect health. And so then the question came, is gentrification something in and of itself that can impact health? I can't say that I've found the answer, but I'm hoping that by the end of our discussion today with our panelists, we'll at least know a little bit more and be able to go back to our respective institutes and organizations and our various roles and think carefully about what we learned today and how we can influence change. It's also not clear to me what the return on investment is, that when you invest in neighborhoods and you help them to change, what is your ROI in regards to impacting health outcomes? And then in that same regard, which systems reap those cost savings? So if you revitalize a neighborhood and gentrification is happening, or the residents end up displaced, then how do you figure out what those cost savings are and who's really getting the benefit? Well, our speakers today will talk and touch on each one of these issues. So they will do a 10-minute presentation each, where they'll tell you a little bit about their work and as it relates to gentrification and health, and then we'll have a moderated session of questions. You'll notice that there are index cards on your table with little pencils. If during this time as they're speaking, or even during the first part of the moderated session, as you have questions, please write them down and hold them up, and Tara will come around and collect them, and then we'll select some questions at the end of our time together to ask our panelists from the audience. So without any further delay, I'd like to welcome our speakers. We have Vicki Booth from the CDC, Lance Freeman from Columbia University, Ruby Mendenhall from the University of Illinois at Urbana-Champaign, and Tran Nguyen at the Alameda County Public Health Department. So join me in welcoming them today. And then our first speaker will be Ms. Booth.
Good morning. I am delighted to be here, although I'm going to say first off, I am not an expert in gentrification, and I was very clear about that. So actually when Dr. Moore contacted CDC, I think she was told and directed to me, and I was talking to a colleague, and because they said I was probably the closest to an expert in gentrification the CDC had, and I said, oh dear, that's probably true, and that's really scary. So anyway, without further ado, so my area of study and of expertise is really about the neighborhood factors or characteristics that can either create health or degrade health. Am I too close? It sounds like there's a little echo.
You can back up a little bit, but you're fine.
All right. So from the literature, what do we know about the factors that do that, and how do they work individually, and how do they work in combination? And then using local level data to actually measure community health, understand the health promoting factors, and also understand the risk factors. We'll talk a little bit more about that in a minute. And then more recently, in the last 5 years, I've really looked at, well, we can really characterize neighborhoods and health very well. What do we do to improve it? So we've really been focusing on evidence-based, cost-saving strategies that deliver outcomes and return on investments, where you can see measurable health improvements within a 5-year time period, and also that directly address those social determinants. So this is a definition from, and I took it actually from Jonathan Fielding, who was director in LA County, of what a healthy community is, and it says it meets all the basic needs, and you have safe, sustainable, accessible, affordable transportation options. I'm not going to read all the adjectives, but each one's there for a purpose. And you have affordable, available, nutritious foods, really important, and I might have put this at the top of the list, affordable, high-quality housing, access to quality health care, and all of these other things that are really important, including access to good jobs, good schools, places for physical activity and green space, available, affordable childcare, and financial services. So that's what makes a community's population healthy. What makes the degrading factors, so this is based on research by Nancy Krieger at Harvard. I highly suggest you look into it if it's an interest of you. So for census tracts, and that's really a neighborhood, census tracts has an average of about 4,000 people. When more than 20% of the population lives under the federal poverty level, then we have health disparities. And it's not just the poverty, that poverty just in that 20% just is a really good surrogate factor. It's a confluence of all of these factors: unemployment, violent crime, safety hazards, exposure to pollution. And there's been getting a lot of attention. This was before Bernie Sanders was a presidential candidate. This was back in 2013. He and Elizabeth Warren had a 2-day Senate hearing on those neighborhoods with high poverty. And what he found was there's huge disparity, and it ends up costing people years off their life, and I'll show you that in a minute. So he talks about, in many ways, the stress of poverty is a death sentence, which results in significantly shorter life expectancy. Those pictures on the right, that's Boston and Baltimore. They have lower life expectancies than Ethiopia or Sudan, and there's neighborhoods like that all over the country. And surprisingly, so if you've been to Baltimore and even Boston, you know that there was areas of those cities where you might expect some poor health problems. Seattle, how many of you been to Seattle, King County? This was amazing to me. So led by Dr. Fleming, who was the health officer at Seattle King County, they went in and mapped life expectancy at the neighborhood level. And what they found from those counties in the dark blue up there, and they're just a few miles from the ones in the red, and there's a 30-year difference in the life expectancy in the neighborhoods in the blue and the ones in the red. And we've been doing a lot of work in that area. If you're interested and you want to have life expectancy in your neighborhood, catch up with me afterwards. So really quickly, I want to go through, getting back to the topic at hand, gentrification and displacement. I want to talk about a cautionary tale right in our own backyard in Atlanta, the Eastlake Village. So in Eastlake Village was a public housing that was built on a golf course where we had white flight in Atlanta, and in 1960s this area was 95% white. By 1980s it was 95% black. And they had taken the golf course and the country club and moved it up north out of the downtown area. And so what they did was they built a housing project, and it was Eastlake Meadows. And in 1995, it had 18 times the national crime rate. In fact, they called it Little Vietnam. $35 million a year drug trade. It was 100% public housing. In 1995, 40% of the units were unlivable. 13% employment. And the median income was about $4,500. 59% of the adults were on welfare. And it was one of the lowest performing schools in Georgia, only a 30% graduation rate. And so, of course, what happened in Atlanta in 1996, the Olympics, and it was Governor Carter, and they decided in preparation for the Olympics that they were going to invest in some of these public housing areas. And Eastlake was one of the ones. So here's Eastlake today. So 73% reduction in crime, 90% reduction in violent crime, high quality private managed housing, mixed income, 1,400 residents in 542 apartments, 75% employment, and the education level has really improved. 98% of the students meet or exceed the state standards, and it's now a top performing school. So that's a miracle, right? This is a huge success story. It's so much of a success story that giants in public health have published Lancet articles. David Williams at Harvard, international expert in disparities, has this as one of his case studies. So I just happened to be at a conference where this was being presented, and I happened to be sitting next to a colleague that had worked in that health department for that area. And she leaned over and said, "That's not the real story." She said, "Those aren't the original Eastlake residents." So she didn't know how many had moved because we don't have that data. And you'll hear this morning, I don't see us having that data anytime soon. So before I go into that, so it was so successful that this organization came together and they decided to model and scale a model. They call it a PurposeBuilt Community. And here's the steps. You define a neighborhood. You replace concentrated low-income housing with mixed-use housing. You do a cradle-to-grave college pipeline. And then you have some effective high-quality wellness. So they talk about they put in a YMCA and a few other things there. And you can see in the map on the right-hand corner, they're now expanding this model all over the country. So after my colleague said that's not the story, I started doing some digging, and I found a 2013 study on education there. And buried in here were these stats that said, from this education, and it was done by Tufts University and the Center for Promise. And it said only 27% returned in that 10-year period. And then it goes, well, 44%, they had housing vouchers and they decided to move to other neighborhoods. 24 decided that they would go and live in a different housing project. And 5% moved to other mixed income neighborhoods. So this is my last slide. That might have been the end of this story. And even on that, I was starting my email writing campaign to all of the public health people that are touting Eastlake. And then a Emory graduate that just got his PhD, Adam Goldstein, for his thesis, did the Eastlake Story. And it's horrifying. I really encourage you to read it, and he does such a good job. The link is to a blog. And so what really happened was there were 750 units, and the plan was, so they told all of the community there, and they had a fantastic leader, right? So you see Eva Davis, she's down in the picture there. So, and they had 2 attorneys. Jimmy Carter actually appointed an attorney to help defend the residents. But Tom Cousins had come in. He wanted to revitalize that golf club. He wanted to change the community. And so originally 650 units. And what they said is he's going to replace those with 206. And they were going to build new housing units for the families that couldn't fit into the 206. But what happened was the demolition started, the new places weren't built, and what Adam found was of the 423 original families, only 16% returned to the village. And this is a quote here. So a defeated even they took them to court, the community did, and they lost in court and could not get an injunction to stop the demolition. And so a defeated Eva Davis told the housing authority that what y'all are doing to us is not right. Davis believed she had made a mistake working with, and so the housing authority she had been a Wall Street banker and had come down and gotten on the board of the housing authority. But she said, I accepted that and I have to move on. So that's my cautionary tale.
Thank you. Lance?
Good morning, everyone. Thank you for having me here. I'm really excited about an opportunity to participate in this conference this morning. I think I hope to learn a lot, and hopefully I'll be able to share some insights with you. I became interested in gentrification, a little bit about my background. I grew up in New York City, came up in the late 70s and the 1980s. Conditions in the city at that time were a lot different than they are today. Much of what Vicki just eloquently shared with us, it was what you see now in popular TV shows like The Get Down on Netflix or The Deuce if you watch HBO. That was the New York City I remembered, and I went away to school to North Carolina and came back around the turn of the century and saw things were changing a great deal. So that's, more specifically, gentrification was happening in neighborhoods that were long written off, that had experienced a number of the problems that Vicki just shared with us. And so that's why I got interested in studying the topic, and I've done research looking at how gentrification impacts residents, looked at issues of displacement, how people feel about what's going on. And what I wanted to briefly talk about today is just thinking about displacement beyond physical displacement and what that is, what are some other things we need to keep in mind aside from the concern with physical displacement, which I think is very important. However, is not the end-all or the only issue related to gentrification and how it could have negative consequences, included related to health-related issues as well. So, as Vicki mentioned, low-income minority neighborhoods over the past few years They're perceived as having a number of problems, pockets of concentrated poverty, underperforming schools, high crime rates. Oftentimes they're food deserts, meaning they lack access to healthful food outlets. They suffer from racial and ethnic isolation, right? So many of you are probably familiar with this litany of issues and problems that have characterized many low-income minority neighborhoods across the country for decades now. Gentrification now, though, is starting to reverse that. This chart shows cities that have been experiencing gentrification since 2000, and you can see it's across the board. You have cities on the West Coast, the East Coast, but also mid-sized cities, cities in the South as well. And so what you're seeing is in the left-hand column, cities are experiencing gentrification, yet at the same time, some cities are also experiencing declines as well. So you have a sort of a bifurcated process where gentrification is happening in cities. At the same time, many neighborhoods are experiencing some of the same problems that Vicki spoke about and I just briefly mentioned. If you look at this in terms of race, this is some research that I've done that looks at black neighborhoods that have experienced an influx of white residents, and this looks at data going back to 1980, and it shows the proportion of black neighborhoods that are experiencing an influx of whites in this century is at least twice as high as it was in the last decades of the 20th century. So if you look at gentrification in terms of race, clearly what you're seeing is that there's a significant increase in the last 15 to 20 years in terms of whites moving into neighborhoods that are predominantly black. And again, this is relatively unprecedented. Historically, the concern was white flight from central city and inner city neighborhoods. We're starting to see a reversal of this process. This next chart shows the number of neighborhoods. These are neighborhoods that started out as 90% black in the beginning of the decade and then experienced an influx of white over the ensuing 10 years. And so you can see starting in 2000, you really start to see a big uptick in particular cities like Washington, D.C., New York City, Philadelphia, and even some southern cities, Savannah, Atlanta, for example. And it carried over, it seems to be carrying over into this decade as well. So these are neighborhoods that, at the end of the 20th century, many people had assumed they would remain racially segregated, but they're starting to experience gentrification. And many people, I think as Vicki's presentation highlights, tend to see gentrification as a positive. It's bringing the middle class back to poor central city neighborhoods, right? It's encouraging investment in a decaying housing stock. It can attract retail commerce, right? So if you have a neighborhood that was a food desert, gentrification could bring in new retail that could help address that. And it can also strengthen the tax base, right? Housing values typically rise as a result of gentrification, and so that can strengthen the local tax base. So for those reasons, not surprisingly, many policymakers tend to see gentrification as a solution, right? Not necessarily as something that's problematic. And I think there are indeed some positives associated with gentrification, and this is just a brief listing here. However, I think that, displacement is obviously a major concern. People worry about losing their housing. And to some extent, policymakers have responded to those concerns by implementing housing policies that address that. And hopefully we'll be able to talk about that in some more detail this morning. I just also want to highlight, though, as I said at the beginning of my presentation, that the concerns go beyond physical displacement, right? So I'll share with you a few slides based on research that I've done that shows, what are some of the other concerns. I'll preface this by saying most of my research has taken place in low-income African-American neighborhoods, but I think it would apply to other neighborhoods experiencing gentrification as well. So, for example, here's an article that was written about changes that are happening in Harlem by a resident. in the New York Times. And there's this fear that Harlem is losing its identity as a black neighborhood. Here's another example illustrating how people's concerns about gentrification extend beyond simply being physically displaced, where in Portland, in a community, people were fearful of a Trader Joe's coming in. I actually like Trader Joe's, but people were concerned that this would be a harbinger of gentrification to come, and so we're battling it, right? They were fearful of that, okay? How many? 3? Okay. This article, I think, kind of really says the feelings of many people very succinctly, where people felt like they were becoming outsiders in their own communities, right? And so why is that? Why do people feel like they're becoming outsiders as a result of gentrification? Well, the research I did in Harlem in the earlier part of this century, people talked about feeling like they were being pushed out, right? This was a homeowner who lived in Harlem, and I was asking her how she felt about what was happening in the neighborhood, and she said she felt like she was being pushed out, right? She felt like there was an effort to push longtime residents out of the community. This slide highlights one conflict, and I think kind of illustrates what I'm talking about. There was a sort of a tradition where people would get together in a park and drum on Sunday mornings every week when the weather permitted. And this had went on for several decades. As the neighborhood started to change, people started to complain that the drumming was a distraction or a nuisance, right? And the police became involved and asked them to stop. And so there was this conflict about people continuing a practice that had went on for several decades that the newcomers felt like was offensive or a nuisance to them. Okay, so that's sort of a microcosm of the sort of some of the type of tension that can arise from that. Here's another example in Oakland, California, where a church was threatened with a fine because the way they held their services was viewed as being too loud, as violating certain noise ordinances, okay? So this was, a long-standing practice, but people who had moved into the neighborhood felt that, the church should obey the existing noise ordinances or be fined like anyone else, okay? And of course, Spike Lee, the filmmaker, had a well-known rant or complaint about what was happening in his neighborhood. I'll just give you a minute to read it. I thought it was very colorful the way he phrased it. But basically, just to sum up, he was articulating, his concerns about what was happening in his Brooklyn neighborhood, where people felt that their norms, their practices were being taken over by people who had come into the community in more recent times. Okay, so. Just to sum up, I just wanted to highlight, I think, when we think about the challenges about gentrification, it's true, I think, that gentrification can bring some benefits to low-income neighborhoods to address some of the problems that Vicki spoke about in her presentation. However, it also raises the issue of displacement, which I think many of you are familiar with, and the need to address that through affordable housing. But also it raises the issue of sense of community, of people's, of the local culture in the neighborhoods, and the importance of that to people beyond just affordable housing. And I think to the extent that we want to build healthy, just communities, we should keep that in mind as we start to think about how gentrification can impact communities. Thank you.
Good morning, everybody. Thank you very much for inviting me to be here to talk about my research and kind of think about gentrification and what it means. So my research is in Chicago. This was the headline of the Sun-Times January 1st, right? Our city, 1 year, 780 murders, and I think over 2,000 shootings. I didn't look at that number before I left. And so Chicago, certain neighborhoods in Chicago are really experiencing issues around violence, to the point that we created a documentary to talk about mothers who have lost children to violence. So I just want to show you the trailer to this documentary. So just a warning, hopefully it won't trigger anything, but just a warning.
It was about 4 o'clock in the morning. I knew it was a bad call simply because of the timing.
I had to work that day. I worked the overnight shift at the time.
And I was sitting in my bed watching TV.
And I told Gerard, stay in the house.
And he was like, oh, Uncle Julian, I'll be right back. Then that never happened.
I was scared. I was scared to death.
I have some bad news, and it doesn't look good.
By the time I was running out the house, I see my cousin Tiara. She was at the corner and she was like hysterical.
I prayed that he was just hurt.
And so you get down there, and what happens?
I arrived on 67th Street. No police officers there would answer my questions.
Then the police came and they roped off the area.
They're like, can I help you, ma'am?
I said, wait a minute, I'm his mom. Let him hear my voice.
So by the time I got to the corner, that's when I saw him.
He was under a sheet.
I was just empty. How he gone and I'm still here? That's not right.
And I used to hear that childbirth was the worst, but no, it's the ultimate anguish that you can feel.
But I was trying to suppress the screams. I couldn't stop myself from screaming.
What became clear to me, even though you get a lot of different outcomes when someone is exposed to trauma, is that it can really be very harmful to you psychologically.
And so after that, I just felt like I didn't want to live.
Because my thing was the world was supposed to stop when my son got killed. See, I was confused. I thought the world was supposed to stop.
And what's your son's name?
Damien.
My son's name is Thomas Lee. My son's name is Corey Parker.
My son's name is Raymond W. Pryor IV. My son's name is Kenneth Anthony.
I'm the mother of Gerard Benton.
My son is Ashton Simpson, and he was murdered September 13th, 2015.
And so many of these stories are mothers who live in and around the Inglewood community, which is really experiencing high levels of violence, but Inglewood is also experiencing something else that many people feel is the very beginnings of gentrification. Kennedy King Community College just built a beautiful, beautiful new campus there. And then also, who wants to tell me what else is coming to Inglewood? Library, Whole Foods, right? And some other developments, right? So people are thinking about that. So my research really looks at how the violence affects Black mothers' mental health and physical health. And in terms of how I think about it, I look at it from a Black feminist perspective that looks at intersectionality, right? How does race, class, gender, and other social positions in society play out, right? What's the role of historical discrimination? And there is lots of it that has formed these communities, and then even as they change, that will leave some people advantaged and winners, and then some people losers. And I look at social determinants a lot, but also I'm getting into this idea of structural competence and MELT's enhancement medicine, they talk about it in terms of medical providers, that when you think about health and who's well, who's ill, part of that is understanding how social structures are impacting on their lives and how they do well. So I think about that in terms of housing. And then also I'm working with a colleague, Jean Robinson at the Institute for Genomic Biology, and we're looking at this idea of sociogenomics and really trying to understand how the stress in your body gets under your skin to affect health. And again, that's important to think about these invisible processes that happen, but often we don't talk about. And again, talked about racial zoning, redlining, public housing. I did my dissertation on the controlled housing program and what it meant to move out of predominantly black areas to mostly white or integrated areas, but then also what does it mean to build up predominantly black communities and have those to be safe. And then also in terms of deindustrialization and what it meant in terms of employment, lack of money, and how is that affecting families today. And so a lot of what we try to do with the documentary and even with our research is to really raise awareness about what ABC News correspondents call this hidden America, where many people are experiencing levels of violence that we really can't fathom. And even myself, I do research and I can't fathom what it means to, even as I'm standing here, to have part of my mind thinking about, are my kids safe? Are my kids going to come back home? What's going to happen to them? And many of the women that I talk to, that's their way of life. And as you saw from the documentary, sometimes they do not come home. And so when we recently did about 100 interviews just kind of talking to moms about what is it like, how are you making it, and they talk about this idea that things have definitely changed and that young people are doing more of the shooting and also dying from it. And one of the mothers, though, she said a child isn't born to be a killer, and she was trying to unpack some of these social structures that have led to what we see on the streets of Chicago and other cities. And so when I talked to the moms about mental health, about half of them reported depressive symptoms, about 56% reported PTSD symptoms, because it really is traumatic every day going in and out, and it's also very heart-wrenching to try to protect your children. It's one thing to just have to worry about you, but when you add children to the mixture, it gets much more complicated. And then also in terms of physical costs, they talk about headaches, back pain, stomach pains, hair falling out, having panic attacks. One of the mothers in the documentary, her and her son, they used to like share meals and cook together, and that was the thing that they did. And after he was killed, that she lost her ability to taste food. And then they also, should be sexual appetite, talked about how that has decreased as well. And that's what the stress research tells us, that all of these things happen. So part of my research, part of when I work with students, when I go in the community and we work together with the women, is to think about how can we change some of the very foundational things in America. And I liken it to all of these great advances before, right? So we're seeing the movie Hidden Figures, when I love that scene when they couldn't figure out how to bring them back. And she had this idea about going back to old math, right? What hand washing did in terms of health and prevention of death, right? The polio vaccine, the invention of the light bulb, back to the wheel. Like, what can we do as a society, what can we do as researchers and others to think about these really transformative ways, especially in terms of community, that people can both be healthy and well, and we don't have kind of this displacement, and this displacement being mapped upon black and brown bodies and in terms of income. And so one thing we're thinking about, based on what mothers talked about that they needed, was developing a dream center where there's support for this intergenerational conversation. Because they talk, the young moms, it's like, yeah, people are saying it's us, we're having these kids, but we're not the issue, and we have things to say, and we can teach people. So really trying to have this intergenerational space, a space to grieve. The image on your right is from the Earned Income Tax Credit, where we really look at what it means to give families additional income and decrease in financial stress. So we just published a piece in Public Health that talks about having that extra money over the year, decrease financial stress, which then also decrease depressive symptoms. And then so the last time I was here, I was so struck with Project Row Houses and how they developed it, and how some of it was developed and used by low-income single mothers, right, as a way for them to have decent and affordable housing. So another thing we're thinking about is small homes, right? So even as neighborhoods gentrify, or even trying to stabilize neighborhoods that are in distress, what innovative ways can we think about? And so one of the ideas is small homes that are maybe $30,000 as a cost to participants, but then the rest, once they pay it off, the rest of that money is used for accumulating wealth. And then the last slide I have is we're doing a project looking at how violence, how the sound of gunshots affect Black mothers' physiology. So we have them out in the field now wearing sensors and then trying to talk about this excess death and how exposure to these environments can decrease lifespan. So thank you very much.
Hi, everyone. I'm Tran with Alameda County Public Health Department. My heart and mind are just buzzing after the presentations from my co-panelists, and I hope to contribute to a stimulating conversation. I don't have slides. I apologize for that. So hopefully my talk will be more of a talk. I'm not a scholar or a researcher, so I think I'll try to bring the perspective of a local government practitioner on this issue. I lead our housing and with health equity as a framework at the Alameda County Public Health Department. Alameda County is, for those that don't know, the next county over from San Francisco. We're the East Bay. So our big cities are Oakland, Berkeley, Fremont, and we're really in the thick of displacement, a housing crisis, and rapid gentrification. And I think we'll unpack. My co-panelists did a great job of kind of raising all of the complex factors. So I'll get into a little bit of that, but I wanted to share a snapshot of some of the impacts, right? As a public health agency, we're very much looking at the immediate on the ground impacts that we're seeing related to the housing crisis and, gentrification as part of that and displacement as part of that. But some of the striking impacts, to give you a snapshot, we're one of the highest rental markets in the nation. I think that's well known. In Oakland, the rents have risen 60% within 3 years, the past 3 years, right? So some context, a one bedroom in Oakland now is $2,000 median rent. And wages have not gone up. So some of the factors that, we're facing are rising rents. Quick story, my neighbor's rent doubled, went up to $3,000 for a duplex in Oakland. And and rapid job growth, but rising inequality and low wages. So some of that really impacting the pressures on the housing market. Displacement is a crucial piece of this. We've been tracking evictions very closely, and while evictions data is not good for many reasons, but working with our local legal services providers, we've been looking at some of the causes of rising evictions, and much of that is related to rising rents. So the one study with UC Berkeley's Urban Displacement Project tracked 59% of a rise in evictions that are related to failure to pay rent, right? And then this is pretty, I think, telling, a 300% rise in no-cause evictions. So, our on-the-ground partners, legal aid attorneys, are reporting very much illegal owner move-ins, kind of all of the other ways that that evictions happen, along the way, right, before they even end up in an eviction court. So all that to say, that the housing market pressures that are pushing people out are very much in effect. Some other indicators. Our homelessness crisis is really very urgent right now in our county. We just finished our point-in-time count study was released earlier this year. So for Oakland, we saw a 25% rise in homelessness. And some of that was a self-reported survey. 60% of those homeless residents said they had been housed previously, right? So what that tells us is that it's actually really related to this displacement housing crisis that we're experiencing. That some part of it is the chronic homeless, that issues that we see with substance abuse or behavioral health issues that our sister agencies work on very closely. But a big part of that is a recent, connection to the housing crisis in our region. A lot of those newly or more recently homeless residents are older. So recent studies have really linked or seen that linked to people 50 years of age or older who are now, homeless because of a crisis event in their lives, a spouse dying or, getting ill or losing income. And then the other thing to mention too is in Oakland, I think a recent study tracked 100 homeless encampments. So visible homeless encampments, unsheltered homelessness is very much a factor in our landscape. It's a small city for folks that have been to Oakland. And so everywhere you go, basically from the lake to, downtown to now even more of the middle class neighborhoods, a few tents here and there under the freeway to, large encampments. And that also is driving a lot of our policy debates and our public debates about what to do. And then finally, I think the other thing I'll mention about sort of impacts that we're looking at is tracking the actual, displacements from our county, right? And the sort of what we're calling the sending counties, which are the wealthier counties, San Francisco, San Mateo, and Alameda. Many more of our residents have now are lower income, working class residents, African Americans, people of color are now being, tracked to the inland counties, Contra Costa, and even Central Valley parts of California. And, it's hard statistically to track, but a number of studies have been done. I'm thinking of one, a recent one by a group called Urban Habitat that looks at the resegregation by race and income of the Bay Area. And so what we do know is that, poor communities are cropping up in sort of the farther inland cities of Antioch, Pittsburgh, people commuting from as far away as Sacramento to work in the Bay Area, and or even to commute to their schools or to social services and health services and other community networks. Long commutes increasing, and our health department, along with others, a collaborative in our region, are looking at the health impacts of that from everywhere from stress from long commutes. Some of our survey respondents, report spending 2 hours in the car, and that's the only time they have, as a family to spend time together, or or spending the night right to work and then commuting home for the weekends. Many related health impacts to that. A survey we did with our health providers found people having difficulty getting to necessary medical appointments in the city centers. The Children's Hospital in Oakland, for instance, we have medically vulnerable infants that we're finding among our clients are really having trouble without car access, with poor public transit, to make it to necessary medical appointments, for instance, for their children. So just a snapshot, right? But I wanted to get into what our role has been and how we're thinking about it as a public health department. And this is very much a learning practice. I think we feel like we're sort of trying a lot of different things and being an activist as a public health agency in partnership with many different community and intergovernmental partners, trying to figure out what we could do that could work. So we're still very much learning, and would love to. I'm here to learn from all of you as well. One thing I would recommend that's been helpful for me and for us is a framework developed by Martha Matsuoka at Occidental College. It's called Power Building in Place, Framing Community Development Issues and Solutions. And where we've been trying to take a step back, I think, in looking at gentrification and displacement and development issues, Martha's work has been really helpful in sort of, establishing a short, a brief one-page kind of breakdown of, naming the systemic conditions that are in effect, right? The structural racism, the neoliberalism, the power imbalances happening, and then naming sort of the different political and policy agendas and the values that are competing, right, within the policy approaches that we see. On one side, the community-driven agenda, what that looks like as, putting forward values like housing as a human right or housing as a public good, and, community participation, community ownership. On the other pole, the market-driven agenda and what that leads us to. And just quickly, I find that it's helpful to name those dynamics and values before we even get to the policy approaches and strategies that we're talking about, and to think about, what do we need to shift, right, in terms of that narrative and those values, and to build, the political will and sort of the broader public discourse around this. And that's where I think our role as a public health department has been valuable for our community organizing partners, to contribute to shifting that narrative through a health lens. We've done a number of projects, looking at life expectancy, as Vicki mentioned, and then also looking at sort of more of the local data on a social gradient, that can be connected to housing. For example, hypertension rates we've looked at connected to severe housing cost burden, asthma rates, asthma ED visits connected to the rise in overcrowding in our county, mental health ED visits connected to severe housing cost burden. And it's a correlation, but it's a way for us to, I think, enter the public dialogue and the media coverage in particular. We did this about 3 years ago in partnership with a community organization called Causa Justa Just Cause, and put out a report called Development Without Displacement that really kind of helped us, as an agency, and then also our local kind of, public conversation to broaden it beyond housing and to talk about health and public health issues as part of that. I think the other piece, and I'll just kind of wrap up around this, is the importance of building power and thinking of ourselves within an ecosystem of creating change. Right? So I think the framework we use is a very much a movement building framework, and a public health agency and a local government, actor as part of that, as a partnership within that, and how to build and share power with communities. Right now, we are in the middle of trying to implement housing dollars. We passed a housing bond for affordable housing last year, and a piece of that is around anti-displacement funding. So actually trying to put public resources into preventing displacement, around eviction defense, and also emergency cash assistance, rental assistance, because I think our thinking around this is very much, a public health kind of crisis intervention approach, that we need frontline defenses. And I think it's very specific to regions, right? Housing and gentrification issues are so local in some ways, but for our region and our cities, I think the first priority that we were hearing from communities is the need for stabilization and baseline protections, so that we're kind of stopping the bleeding, right? And a critical piece, I think, of these efforts is for sort of real power sharing and power building, so that communities are at the table, in these processes, not just to provide input sort of in the ways that we used to do it, but, in this kind of very uneven way, but to actually think about how to change our practices so that there's real co-designing of solutions and implementation, and sort of a longer-term, accountability and partnership, so that we're transparent, we're iterative and accountable for problem solving and correcting, and really listening and partnering with the communities that are struggling and working on these issues. So I will stop there because I'm probably out of time. Thank you.
Thank you. Thank each of you. Thank you so much. So we've been using this word gentrification, and so the first part of our moderated session will really be drilling down into gentrification, really what that means. So my next question really is for all of the panelists to answer, and we can just go in order. So Maureen Kennedy and Paul Leonard of the Brookings Institute wrote that gentrification is a politically loaded concept that generally has not been useful in resolving growth and community change debates because its meaning is unclear. Vicki, how do you define gentrification?
Well, I love the form of your question, and I'm sitting here looking at 9 published out of the peer-reviewed literature different definitions of gentrification. And some of them are about class, some middle class displacing working class. Some of them are race-based. Some of them talk about, in measurements of my field, so an improbable increase in the number of college graduates or the average education level. And I also think, we always look for that silver bullet, right? So here's gentrification, here's exactly what it looks like every time it happens, and here's the key to solving it. And I think maybe all of these definitions reflect the fact that if you've seen one area gentrifying, you've seen one area gentrifying. So I'm going to agree with the hypothesis that until we can agree and measure and find out, is it displaced? How do you even measure displacement? Is that out-migration at a rate higher than the migration of the local area, the national migration rates? So my answer is, I don't know, but the definition has some problems.
Thank you. Lance?
I like to use a sort of general definition where gentrification is when it's a process or happens over time when a neighborhood or neighborhoods that were relatively low income and that had experienced disinvestment then start to experience an influx of higher socioeconomic status residents and also financial or economic investment as well.
Ruby?
So for me, I'm going to read from the U.S. Department of Housing and Urban Development, one of their documents ensuring equitable neighborhood change. And it says, gentrification is a form of neighborhood change that occurs when higher income groups move into lower income areas, potentially altering the cultural and financial landscape of the original neighborhood. But it goes on to say that with the increased demand and housing costs comes increased housing cost burden, the potential for displacement of long-term residents, and then also what we don't think about, right? Long-run resegregation of neighborhoods, and then also heightened barriers to entry for new low-income residents looking to move to the place of opportunity, right? So those other two things are important as well.
Excellent. Tran?
So in this report that we worked on, Development Without Displacement, we defined gentrification as a profit-driven remaking of urban working-class communities of color neighborhoods that have been characterized by disinvestment. So I'm not an academic, and I kind of just use definitions when they're relevant and for the purpose at hand. And I think this question of defining it is really complex, right? And it's, many different factors, drivers of gentrification at work that are political, economic, social, historical. So what I will say is, there are so many dimensions that we've talked about. I'm really struck by, Lance's point about gentrification displacement beyond housing and kind of how to, to unpack those. But I think what I feel like is another dimension is from a documentary in California that some of our partners were part of, called City Rising. And in it, Dr. Manuel Pastor at USC talks about gentrification as a civil rights issue of our time. So the dimension of, of disinvested communities of color that are being dispossessed in many ways, right? And losing not just economically and culturally and community resources, but political power and civil rights as well.
That's good. So our next question is, and this is also for the panel, what are the economic and social forces really driving gentrification? Vicki?
So when you've seen one gentrifying, no. So, and this is why I was really hesitant when I was first approached, because this is every hot button issue, right? This is discrimination, this is racism, this is classism meeting capitalism and the free market and the American dream that you can go to college and get out and move into a neighborhood and have good schools. And so those are some of the forces. Plus, I think we'd be remiss if we didn't mention the growing income inequality that's been happening for the last 10 or 20 years, where we've created a 1% that can go in anywhere they want, and the rest of us, the 99%, have various degrees of diminished power. So.
Yes, I think on the economic side, there's a number of factors that have been contributing to gentrification. If you want to go back to the post-World War II era, when America was experiencing the zenith of suburbanization, that was a time when people were moving to the suburbs, the interstate highway system was being built, manufacturing was dispersing from central cities, both as a way to escape heavily unionized labor forces and also to take advantage of more space. And so the central cities were generally hollowing out. To some extent, that started to reverse starting in the last decades of the 20th century, when the economy became much more of an information economy, where people valued face-to-face contact, where things like investment banking or marketing or business consulting, those types of industries start to play a bigger role in the economy, and those industries are more likely to want to locate in our central business districts, in our downtowns, right? So that makes the downtowns much more attractive, and people want to be near those businesses. So that's just, an example of an economic thing. I think on the social side, there have been some big demographic changes. The demographic transition that has happened, whereby people are marrying later, they're having fewer children, they're less likely to stay married, and so you have a much bigger population of adults without children for whom the suburban amenity package is not that attractive. Those folks see central city living where there's more economic and social diversity, there's more cultural offerings, and people, they just don't need a backyard or a big house. They see central city living as much more attractive. So those demographic changes combining with the economic changes, I think, has increased the demand for living in central city neighborhoods. At the same time, I think policymakers, for some of the reasons I mentioned earlier, have also been eager to promote gentrification because they oftentimes see it as a way to alleviate some of the problems that Vicki talked about in her first presentation, poverty concentration, a declining tax base, and the like. And so I think the interaction of all those forces has contributed to gentrification increasing in the first decades of this century. And I think, I'll just end by saying I think it's in part a worldwide phenomenon. The term gentrification was initially coined by a sociologist in Great Britain in the 1960s to describe what was happening in London. So these demographic and economic forces are playing out worldwide. So it's not just something happening in the U.S.
Mm-hmm. And then I'll add to that. So in the 90s, there was public and private investment in downtown areas, and that also spurred some of the gentrification. And research shows that public investment often leads then to private investment. Hope 6 started in 92, right, where they demolished 96,200 public housing units, and in many cases replaced them with mixed income housing. And so you had the increased amenities that attracted people. However, the rate of return was less than 50%. So even if you think about 50%, there were 48,100 residents who did not return to that more opportunity and resource-rich neighborhood. And then also between 90 and 2012, the crime rate fell about 44% nationally. And so scholars argue that that also made it feel more comfortable for many middle income and white families to move into some of these neighborhoods. And as I described, right, because the crime is for real. And if you have resources, you usually don't put yourself or those children in those settings. And then again, in terms of consumption side, like Lance already mentioned, in terms of young people who are getting married later and they don't necessarily need the suburban living, the suburban lifestyle, and they want to be closer to their jobs, they're working long hours already and don't want to spend a lot of that time in commute, and even that they are attracted to a lot of the cultural aspects of some of the neighborhoods, but yet at the same time, they try to regulate and even decrease it. So those are some of the forces that I would talk about.
Yeah, and I don't have a lot more to add. I think one other thing I'll throw in is the transit investments. We see really relevant where we are transit investments that can then open up, access right to the urban core. In Oakland, we have a bus rapid transit development coming through from downtown through East Oakland, and that sort of expansion of the bus rapid line, it's a real issue now of what happens to the lower income working class communities there that will now sort of lose parking. We'll have sort of better transit in some ways, but business displacement happening, that kind of thing. The other thing I'll mention is I think it's a really important question to get sort of, I feel like we encounter a lot around the issue of gentrification, this sort of approach that is a little bit more, insidious and individualized, and seeing it as a very atomized issue in some ways of people dealing with their individual housing issues or their economic, hardships, and kind of the importance of looking at the drivers, as Dr. Moore asked, but also kind of really looking at the unequal power relationships, right? So that, when we look at some of the stories of gentrification playing out, there's very uneven power, and for the communities and the residents in gentrifying neighborhoods, what they often only have is people power, right? In the face of moneyed interests and political power that would like to see, gentrification. So I think, that's very pertinent for us as part of trying to figure out solutions in our county, is trying to take it out of that very individual, atomized approach of, we could just serve our way out of this, and we can't.
Thank you. So each of you talked about race in some context or another, and about structural racism and how that's played a part. I'd like for you perhaps maybe to expound more on the issue of race as it relates to gentrification. I mean, many of you describe these areas of concentrated people of color. And so is it impossible to have gentrification if you have a low income, all white neighborhood? Or, how is it really that race? Help us to better understand the issue of race and gentrification. And it's open to the panel.
We're not going in order.
So, now why don't we go this way this time?
It's a tough question, so I'm leaving it open.
Well, plus the person at the end, right? So,
Sure. Still very rough thoughts. I think so. In Oakland, we saw a 40% decline of the Black community in Oakland from 1998 to 2011. Over that span of time, a 40% decline in our African American residents. San Francisco is another very well known. I think African American residents are now 5% of the population. I was just reading last night. So a very marked decline in the African American community is a real strong, a racial indicator for us. Some other things I think around, the homelessness crisis that I talked about, a very visible racial dynamic there. 90% African American in Oakland, for reasons of, there was a large Black community, but that's something I think is starting to be talked about, is definitely very noticeable. If you're in the Bay, in either San Francisco or any of the cities that are experiencing this heightened visible homelessness, it's very obvious that it's elderly people, it's African American, and so I think it's important to name and understand those racial dynamics. And so just to start to unpack, I think there is a racial dynamic going back to the systems of structural racism. We look at, in our county, kind of the histories of redlining, right, and disinvestment in East Oakland or West Oakland, for example, and the structuring of lack of access to opportunity, lack of resources, the life expectancy gap in our county and in Oakland especially is very racially marked. African American men are the lowest bar of that, right? I think the difference between African American men and Asian American women, me and my husband, are 20 plus years apart, the highest range, and then the average range is about 15 years in our county, in Oakland, and so much of that is linked to poverty and race. So I'll stop there.
Mm-hmm. Yeah, and I think I'll say in terms of again, this idea of structural competence, of really trying to get a handle on what are you looking at. And often when you look at neighborhoods that are being gentrified, there's a whole history of structural racism from, like you mentioned, the racial zoning, redlining. The Federal Housing Administration gave higher ratings to mortgage applications where there were no Blacks in the neighborhood or there were no Blacks nearby. They lowered the risk for properties that had restrictive covenants, and just many ways that they built into the institution of housing ways that families of color were disadvantaged, and where white families were able to be advantaged to accumulate wealth, to have the power of the government behind them, and then also again to maintain those restrictions. So I was just reading in a book, The Color of Law, by Richard Rothstein, where he talked about even the University of Chicago, right? I think between 1930 and 1947, that they invested like $100,000 in maintaining racial covenants and preventing African American families from moving in those communities surrounded by the University of Chicago. And so I think in all those ways, historically, this is what happened that has led to this segregation and hyper-segregation. And then we think about how will gentrification help that? In many ways it won't, right? Like there'll be this transition and certain people will be pushed out because in the US, that's our history and our present. But again, I argue that we can think about ways where that can happen, but we'll really have to be aware of the values and how it got to be that way. Thanks.
Yes, I don't see gentrification as necessarily having to involve race. If you recall, I just mentioned that the term was coined in Great Britain in the 1960s before they had an influx of immigrants. So they were talking about gentrification in terms of class. I do think, however, because of the correlation or the overlap between class and race in the U.S., a lot of times it does involve race. But you could think of neighborhoods I'm familiar with in New York City, like the Upper West Side, for example, or South End in Boston, that were working class white neighborhoods that experienced significant gentrification. And on the flip side, there are instances where middle class African Americans or middle class Latinos or Asians can also be gentrifiers. I had a student write a paper about a neighborhood, I think it's called Boyle Heights in Los Angeles, where middle-class Latinos were investing and moving into a working class or poor Latino neighborhood and gentrifying it. And there have been examples in Harlem or in Bronzeville, the south side of Chicago, that I'm familiar with, where middle-class blacks, kind of consciously saw themselves as reinvesting in these neighborhoods to sort of rekindle the golden age of those neighborhoods back in the 1950s or 1940s, when you had the Harlem Renaissance, or when many African Americans were migrating to those neighborhoods and saw those neighborhoods as beacons of opportunity, in contrast to the way they are viewed today.
And I would just add to that race and racism and Jim Crow laws that led to the great migration of African Americans to the north, and then they ended up in these inner city housing projects. That sets up, that's like the perfect target if someone's going in because they're not homeowners, they don't have political capital. As we saw in the Eastlake, not only did that happen to 84% were displaced, but that was so hidden that we in public health have been going around touting that as this huge, one of three. There's really only 3 success stories like that. It's one of the 3. So I say, and I so agree with Tran, that we need to talk about it, and we need to talk about how that's playing out, and we need to talk with these communities and have them talking together and with us about race and what's happening. And we need a better way to, like I said, Eastlake happened, it's been since 1995, over 20 years. We're just now finding out who got this. We don't know how many got displaced. So we need to figure out a better system of monitoring what's going on. If you wait for the census 10 years later, it's too late.
Thank you. So this question is for Lance. You talked a little bit about in your presentation that there are some benefits to gentrification. Can you talk more about what those benefits are, and what is the group that reaps those benefits, as well as what are the harms, and are there certain groups that are only harmed? Can you unpack this for us a little bit more, what you...
I could do that over the course of the rest of the day. But succinctly, I think the benefits are, obviously, if you happen to be a property owner, you stand to benefit a great deal from gentrification. I've known people, for example, who bought homes in Brooklyn back in the 1960s or 1970s, and their houses have increased, maybe 100-fold. It could be, a really dramatic increase in the value. So certainly people who were fortunate enough to buy their homes and were able to hold on to it across time, they stand to benefit a great deal from gentrification. Some retail owners could benefit if they're able to adapt their business, or if their business is attractive to people who are coming with higher socioeconomic status or more income. They could stand to benefit from that. I think those are, two of the obvious beneficiaries of gentrification. I think, sometimes in terms of the low-income residents that are living in the community, particularly if they're renters, I would see them as being most vulnerable, right? They could possibly see their rents increase and not be able to afford to stay in the community, or if they do stay in the community, they may have to spend an inordinate amount of their income due to that. So they will suffer, some of the pains associated with a crushing housing burden. As I alluded to, also many of the long-term residents, whether or not they're homeowners or renters, may feel a sort of sense of loss of community, right? Their home, their place, they feel that it no longer belongs to them. And so I think that's something that's perhaps not well understood, and people understandably are resistant to change, whether it's in a gentrifying neighborhood or any type of neighborhood. You can see people are upset about their community changing. So I think that is another way that people can be harmed. I think we don't really understand the full dimensions of that. What type of stress does that cause? Is it, long-standing? Is it just a period of readjustment where, just like any type of change, people are going to, complain, or does it have a long-standing impact? Does it disrupt the social ties in the neighborhood that people rely on to get through challenges and what have you? I think we don't really have a good grasp on how that impacts people. So I think, potentially they can be harmed. Also, gentrification could change. I mentioned it could change the retail landscape. It could change it in a way that's beneficial, right? If stores come in and offer services that were previously not available. So when I was doing my research in Brooklyn and Harlem, those neighborhoods in the 1980s and 1990s were what many people would characterize as food deserts. There weren't full-service grocery stores, or if they did, they had second-rate produce, second-rate meat, and what have you. And so there's an introduction of better retail outlets. At the same time, those retail outlets could be too expensive. Like, so Whole Foods can, they have a lot of organic stuff, and it's great, but it's also called, Whole Check or something, right? Because it's so expensive. So that can cut both ways, where people feel like, they can't, the stores are coming in, there's better services, but people feel like it's not for them, the people who have been living there for a while. So they can see the neighborhood improving, but they kind of feel like it's for other people and they can't access that. So that type of what might apparently be a benefit might not really be a benefit when you start to peel away or really look at who has access to these new resources. And I'll just conclude with another anecdote about people feeling like some of the amenities, like bike lanes, for example, are something that, you might think is, well, that's great. People can bike to work or whatever. They can get more exercise. That's going to, improve their health. But oftentimes people resist that because, again, they see that as something that's being put there for someone else, and that for whatever reason, they don't have a tradition of biking or whatever. They don't feel like that's something that they can access or take advantage of.
Thank you. The next question is for Ruby. Does the process of gentrification lead to better housing stock for existing residents?
I think there are ways that it can, right? That people renovate places that were in poor condition. They build new units where there weren't new units there. But again, the issue is when that does happen, often you see increases in rent, and then again, in terms of, I like what you said in terms of it's very individualized and really trying to pay attention in terms of who can take advantage of these new units, of these renovated spaces, of the increase in rent, and then again, who has to pack up and leave because they cannot afford it.
The next question is for Tran. What is the government's role in encouraging redevelopment and or mitigating the negative impacts of gentrification? Is it possible to do both?
Yeah, it's a very urgent question. We're part of now a regional government and community and industry partnership around Plan Bay Area in our region. That's led by the MTC, which is our regional transit agency, and really trying to bring together. In our county, in our region, there's real consensus now around that we have a housing crisis. We have a shortage of housing. We need more, affordable housing. There's a real lack of, a real disagreement around solutions, right? And the types of development, the types of, things that we need to address the lack of the jobs, housing imbalance, for instance. And so I think, the government's role in this is to help broker the political will, right? That to bring together the community advocates, the tenant advocates, the social services community, and then also, the private developers are very influential in this, very actually an unbalanced amount of influence. So the debate that's unfolding for us is around, is the answer to build more, and that's really driving a lot of the debate around solutions, I think, of development in our region is the answer to build more market rate housing, right? And that'll eventually, address the shortage and trickle down to the rest of us. And I think where, our agency and other, potentially other government actors, public agencies within this are helpful is to broaden the table around this, and to think about, the community is calling for stabilization first, right? And so I think, when it gets down to the nitty gritty, we're going to have to negotiate between these competing interests, and we're framing it as the 3 Ps around, protection of communities and vulnerable residents, and the need for preservation of existing housing, and then production, the development, building of more housing, as kind of the framework of the response in our region. But the realities are that, the last P, production, development, really takes over everything else. So I think, as a government process, figure out a region-wide solution that's going to require a grand bargain of sorts. Those are the issues that play out. How do we lift up the needs of communities for protection, for our front line, so that that development doesn't override, the need for people to be able to not get evicted unfairly, and to start that spiral, right? That costs a lot for society. So I don't know if I'm really getting into the details of your question, but I think those are some of the things as government entities we're grappling with in our development process.
And then, Lance, I'll ask you the same question, but maybe more specifically. So then what are policies that can be put into place in order to prevent this displacement, or is displacement inevitable anytime that you have gentrification?
Yeah, I think it depends on how you're defining displacement. As I talked about in my presentation, you can view it beyond just physical displacement. But if you're just talking about housing and people not being able to afford to live in the community, maybe I'll just focus my brief comments here on that definition of displacement. And I think there are some things that you can do to mitigate that problem. So, for example, you could build affordable housing in neighborhoods that are experiencing gentrification. That, of course, raises the question of where are you going to get the money to do that? But, there are some mechanisms. One, I know Houston doesn't have a zoning mechanism, so it might be hard to implement here, but you guys could correct me if I'm wrong. But an inclusionary housing program whereby you can do it in two ways. If a developer is building a new development, you could mandate that they set aside a certain number of units for affordable housing. That approach is probably a little bit more controversial because you're mandating it, and the developer could, in theory, just decide not to build there. Optionally, and this is where the zoning comes into play, you could include a density bonus. So you say to the developer, well, you're allowed to build 100 units in this area. But if you include, 20 or whatever, 30 affordable units, will allow you to build 150 units, okay? And so building more units means more profit for the developer, and some of that could be used to offset the cost of the affordable housing. So that's one mechanism. On the policy side, states could also, when they issue their low-income housing tax credits, they could, and states do this all the time. They allocate their tax credits. They target certain types of neighborhoods. Some states will target neighborhoods that are near transit infrastructure, or they might target it in a way that it's environmentally sustainable or whatever. They could target the tax credits to neighborhoods that appear to be at risk or that are experiencing gentrification. In other words, a developer who submits a proposal to build affordable housing using their tax credits in a gentrifying neighborhoods would be viewed more favorably than a developer who's building affordable housing in another type of neighborhood, right? So that's another mechanism that you could use. There's also housing vouchers that are often used where people are given, subsidies to try to look for housing. Again, you could try to target them to certain types of neighborhoods, either through outreach, right? The housing authority could connect with landlords in those areas to try to get them to participate in the program. Or, and there's been some discussion about this, I think it's been rescinded under the new administration, but the way the housing voucher works is the subsidy is based on the housing cost for the entire metropolitan area. You could tweak that so that the subsidy is bigger depending on the costs in a particular neighborhood. And what that would do is that would make it easier for someone with a voucher to stay or move into a neighborhood where the rents are rising very rapidly. So those are just a few strategies that you could put in place that would mitigate some of the housing cost problems in terms of displacement that are related to gentrification.
Thank you. The next question is for Vicki and Ruby. So how is access to health care, both physical and mental, impacted by gentrification?
So I think that depends on the characteristics of the area that's being gentrified, is my first comment on that. And you'd have to ask, what's the transportation options for the residents? But what I really want to say, so based on all of the work that I've been doing in terms of what are impactful, cost-effective, cost savings interventions that improve measurable health outcome of communities, right? Because every time you're going to invest in a park or in a farmer's market, that's a dollar that you didn't invest in something else. And so I will just say from my population health perspective on the idea of health care, so even if every resident had 100% access to high quality care at low cost, you could only improve the health of that population by 10% overall. Healthcare only contributes, and that's generous. A lot of the research says it's somewhere between 5 and 10. So it definitely could impact access to health care. It might increase it for the populations that's there. It might attract hospitals and acute care units. But if you're really concerned about improving that population, that's probably not the first question I would ask. So,
Good, thank you.
And I would think about it, I guess, in terms of decreased exposure to violence, right? Because again, areas that gentrify research shows generally if the income increases, that violence decreases. And so from my research, right, the things that are related to violence, the post-traumatic stress syndrome, the depression, high levels of anxiety, trouble sleeping, right? When I was talking to the mothers as we just launched the study, and I was asking, how do you sleep? And most of them were saying, like, I don't sleep the night, right? You hear the sirens, you hear the sounds, you know, you're just afraid of who's coming in. And research is showing how important sleep is for the body to recover and to engage in kind of the healing process and kind of boost immune functioning. And then also the stress has been related to cardiovascular disease, to cancer, to diabetes. In the documentary Unnatural Causes, Is Inequality Making Us Sick? They talk about the excess deaths of African Americans, and that's death that you shouldn't occur, and how normally you can predict death based on age, you can predict it based on disease, but then there's this excess level of deaths. And they likened it to the number, the equivalent of a plane full of African Americans falling out the sky every day, every year, right? So there are a lot of these hidden processes associated with stress that we don't know about quite, but we do know that people are sick, that people are dying, and we see this in addition to the violence. So I think gentrification could help with that. But again, I want to stress that those people who do not benefit from the gentrification, then their level of stress and health and well-being has probably decreased a lot. And again, that part I don't think we measure as well too.
Good, excellent, thank you. So, Vicki, you alluded to that healthcare access is not the magic bullet. So then I have to ask you, what is the magic bullet? Where do we need to be making our investments to improve the health of communities?
Yeah, so, and I think a couple of my esteemed panelists have alluded to this, but what we're finding out, and you know, I have to stand or sit right here and say that public health over the last 20 years has probably contributed to gentrification, because a lot of our investment has been in those farmers markets and parks and sidewalks and you know, there is no compelling body of evidence that we can eat our way to good health, right? Individuals can eat their way to bad health, but the evidence, I mean, and part of that's a little bit because it's hard to study, but for sustainable, measurable health outcomes, and if you follow any of Sir Michael Marmot's work on social determinants of health out of the UK, and also the life course theory, right, and also adverse childhood experiences. So what all those things are telling us is that your health trajectory is probably set pretty much by the time you're 2 years old. And so where we really see cost savings, interventions, measurable health outcomes, and measurables for the parents as well as for the children is early childhood home visits, baby-friendly hospitals, centering pregnancy, right? So getting support to women while they're pregnant and offering that support. And we're talking about multi-sector support, right? So counseling services, safety audits of the house, making sure that they have access to financial services. So in fact, for a while I was going around saying we should put every public health dollar into early childhood home visits and other investments, and we could change the health of the nation in a generation.
Any other panelists want to comment on that or have additional thoughts to add?
Well, my thoughts are very primitive at this point, and they are because, right, when I listed all the things that the mothers talk about that they're experiencing, right, they go through life with these intense migraines, with this intense back pain, stomach pain, and a lot of it, the HPA axis, right, is being activated. And you have all of this, and I think about, like, what can be done, because many times they don't go to the traditional healthcare people. They don't feel comfortable with traditional mental health professionals. They talk about going, and the person really can't understand their lived experience, right? Because, again, it's unfathomable, as they say in the hidden America. So I think, and I ask them, like, you know, what do you need? And so I'm just trying to formulate even now some things that can be done as an adult, that can be done. You're in the midst of it. This is your world every day, every second. And what can you do? So stay tuned, because I haven't. Well, I do have thoughts, but I don't feel comfortable putting them out there yet. But
So
yeah, but the women, and I say that again.
No, I said, so stay tuned.
Yeah, stay tuned. Yeah, but the women, I mean, but I do want to say that they are being resilient because they do have to do it. And so I know part of what they say is like this tunnel vision, that you don't focus on all the shooting, all the things that you can't control. You focus on what you can control, that your children are doing well, that you take them, that you keep them very close to you, because your mind cannot take that they are out of your sight, and that there's life and death to them out of your sight. So I'll end there.
So Ruby, as a follow-up question then, something that I think you're alluding to is something called collective efficacy, which we haven't really talked about, but it's really a term that tries to speak to the social support networks within communities, within families. And so there's been some research showing that collective efficacy has really helped to, impact mental health outcomes, as well as building resilience in individuals and in families and then those people in the community. How do you think collective efficacy, or what role does gentrification have in influencing collective efficacy in a neighborhood?
Yeah. So I was really struck about this idea of the public good, and I teach urban communities and public policy, and we're talking about this again when I put up that slide about what can we do that's new and different, but in a lot of ways it's not new and different, right? During the Great Depression, when people were experiencing great housing instability, when people were about to storm the government because they needed services, they were suffering, the government acted. The government, many people felt it shouldn't be an interventionist government and stepped back, but they saw it and they intervened. So, I say that to say that the government has a big role. But until the government takes on their big role, I think in terms of public goods and how can they, so one thing we're looking at particularly in our class is how can they get additional disposable income, right, in terms of collective advocacy. And then that income can be used to remain in housing or decrease housing cost burden. And one way is, people talked about like this community kitchen where you come together, you buy food en masse, right? And then you cook the food and you share it, and that's what children, I have a 13-year-old and I'm amazed, I'm like, man, it's almost like a child again where you have to feed him every 2 hours, right? It's it's really expensive. And so kind of having ways for that. In Champaign-Urbana, we have a place called Salt and Light Ministries where they have it where people can do volunteer work. They get credits in the form of money, but they don't give them the money. They get to shop in a store and buy food. They can buy clothing and they can buy furniture. So again, that frees up some disposable income to be able to be one of these families that have additional resources to take advantage of changes in the neighborhood. And then also housing co-ops, right, where they can get together and pool their resources. But part of that too is for them to have a place and power as the neighborhood changes. And I know with the Baker Institute there, right, Houston is wondering what happens, what do we do in terms of flooding and communities that don't flood, and this idea maybe of kind of abandoning those communities that flood. But then if that does happen, if that's on the horizon, for these communities to have a sense about that and to predict way into the future about what this means for you, and then to start collective advocacy now and in different ways that can play out where they can hopefully be more powerful and be able to stay as things may rapidly change.
Tran, that same question for you. And in particular, maybe you can shed some light on maybe the role that public health departments can play on building community and helping residents to maintain collective advocacy even in the face of gentrification or a changing neighborhood.
Yeah, great question. I'm still thinking about what Ruby was saying. I think some of the things we're involved in, so we have a project called the Healthy Development Guidelines, and it's a planning tool framed around health and equity that we've been working with the City of Oakland's planning department, and but it's a very community-driven, community-led guideline, and we've learned a lot from it. It's been a 3 or 4 year process now of deep, engagement and collaboration with the residents from East Oakland, and it's a funder. The California Endowment has invested heavily in this process, and things that have come out, I think, around this collective advocacy, because for looking at, like, for instance, gentrification and development issues in East Oakland, how a tool like this can come out of an engagement process where residents from East Oakland can really prioritize, right, and participate in saying, this is what we want to see in our neighborhoods. We want development, but this is the development we want to see. Things like, grocery store has been a huge priority for a long time because it's a food desert. So, engaging in that, and it's really an investment in that process of dialogue and working, and before it even gets to the stage of the technical pieces, right, where now we're at, with the planners of, trying to translate those community priorities and needs and wants and dreams into, the planning policies, the procedural changes, the implementation with the City of Oakland that will actually, then create a planning, a health equity-driven planning tool that the city will then implement. So it's now in that process. But going back to, I think that's really, the planning and the foresight that Ruby alluded to. I was thinking about that in light of the question you sent earlier about how communities in disaster vulnerable areas, especially with the climate crisis, how we can start to think ahead of those things. And in our county, we're behind the curve, but we're doing heat mapping and climate vulnerability mapping as a health department in our county, and we've started to also now think about partnering with. In Oakland, for instance, the city has what they're calling the Office of Resiliency. So I don't know how much of a practice that is around the country, but there's an Office of Resiliency, that's charged with kind of planning and working with stakeholders around, crises from an earthquake to, a housing bust maybe, or a financial meltdown, crises that could shake the city's resources and neighborhoods, and really trying to be intentional about partnering with them and bringing sort of this. I didn't know about the framework, but I'm going to look into it and use it. The collective advocacy framework of starting to, like, for instance, one of the lessons we look back on of gentrification in our region is if folks had known, they would have we would have maybe had public and community partnerships around land acquisition, right? So could we have, acquired land in East Oakland when it was more affordable and taken it off the speculative market, and whereas now we're trying to put some of our public dollars to that, and we can't compete with the private investors. They're so fast. So I think some of that foresight and planning and collaboration, we've got to get much better at that, and hopefully we'll be working towards it.
I think that's a perfect segue actually into my next question. So with the recent flooding in Houston due to our hurricane, and then that's not the only time that we flooded after Hurricane Harvey, but many neighborhoods' vulnerability or resistance to flooding was exposed. In your experience, how has disaster-resistant neighborhoods benefited from increased market value? So just as an example, homes that did not flood, a couple days after the flood immediately went up about 10%, their market value. And so how do we, in light of the things that we've talked about today, what are some things that we should be thinking about as we're looking to rebuild Houston and use the influx of resources now that are in our city to think about protecting residents, who are now in these, super hot market spots now. Yeah, and that's open to the panel. So anyone who has thoughts about that, feel free to answer.
I'm thinking of some things. One is this idea of historic preservation, that your neighborhood may have some historic qualities, or you can make that argument and get tax breaks as landlords, or if you're renting a home as they decide to sell, maybe trying to argue for right of first refusal that either, again, a co-op of people can purchase. I think in New York, to kind of deal with issues of gentrification, everyone has access to a free lawyer, and I think that's in law. And so someone to kind of help you think through what are your options, what can you do, and again, ahead of time, and I don't even know, I guess if it went up 10% overnight, like it's too late to be ahead of time, right, because it's already here. And
right. But these are things, Houston will likely flood again, and so, these are things that moving forward, policymakers, our local government are trying to think about is what are some things that we can do now proactively instead of always being reactive. Yeah, so thank you. So now we're going to shift into questions from the audience. Unfortunately, we don't have time for everyone's question, but I hope that the questions that we already asked, hopefully you were able to get an answer to your question, or there'll be just a few minutes afterwards where perhaps you can ask our speakers questions. So Lance, this is back to you. How do you solve the issue of displacement that doesn't deal with housing? And so you sort of alluded to this idea of displacement that's really not related to physical displacement. And so the person who asked this question gave examples of, displacement of culture and minority-friendly businesses. So you want to speak some to that?
Sure. That's a great question. Unfortunately, I don't have a magic bullet. However, I do think that one of the things that was discussed in the previous questions, this notion of collective efficacy, I think that segues into what I think is important, and that is the ability of the community to be able to articulate its interests and its desires and its needs. I think that's important, and I think that often comes about when you have a community that's organized and mobilized. So I think community organizing, community mobilization is very important. I think it could both help address the gentrification process in terms of some of the negatives associated with gentrification, where people feel like development or redevelopment that's occurring, that they have some voice in what's happening. I think it can also ameliorate some of the conflicts and tensions that I talked about briefly in my presentation. So oftentimes what's happening is that with gentrification, you have a different group of people with different expectations or different norms coming in, and people clashing over that. And so I think what needs to happen is there needs to be a forum or a mechanism where people can come together and try to adjudicate these competing visions for what the neighborhood should look like. I'm not trying to say that that's easy or you'll solve all problems, but without that type of forum, without a community that's well organized or mobilized, what tends to happen is that people call in the police to address their conflicts, and that just serves to inflame the underlying tensions that are already there. So I think, just to sum up, I think one step is having a strong community. Oftentimes, you'll have a cohesive community, but sometimes you may need to do some community organizing, some mobilizing to get people to come together to build more cohesion within the neighborhood, and that would allow them to address some of the conflicts associated with other types of displacement not related to housing per se.
And then can I just add?
Please.
So from Chicago, Mindy Fully Love, she talks about roof shock, right? That often what people don't see are these deep communities and networks that take place. And so in Chicago, communities that have been displaced, particularly public housing communities, they have reunions, right, where they return to the space. They have Facebook pages, and those roots, right, are still connected and intertwined, and then they come together as well. So that's one way that people have addressed this issue of displacement and again, these hidden things that you don't see.
Excellent, thank you. And then two questions that we received were really about marginalized communities. And so I'll sort of ask these two questions as one, and then feel free to answer any member of the panel. So, both of these really get to what is happening to the people who are marginalized. So one of the questions really focuses on the homeless who are mentally ill. Where do they go when neighborhoods are gentrified? And the other question, it talks about an LGBTQ community that is in a neighborhood, and they have all their services, or many of them, their services in that community. So again, what happens to these marginalized communities when displacement occurs?
Can I start? Yeah, I think, for instance, the homelessness issue, we see that first, people find other solutions, right? So they're couch surfing and doubling up. So we've seen a rise in that, of overcrowding. And the data, the census data is just a small picture of that, but also sort of our home visiting staff are sources of frontline information around going into homes and seeing, 2-3 families with a curtain up. Or doing home visits and they're on the street corner, and so first there's that, there's sort of the interim solutions, and then one mom in one of our programs I talked to, once she's exhausted that, of friends and family or relatives that, are able to let her crash with her son in the living room, and then stresses arise right out of that, and then she's now in her car and parked in Laney College, community college where she goes. And so then there's that, and then you have the rise in encampments that we're now seeing, which was just kind of over the course of the last year or so that's really exploded visibly, so what happens to people? I think the question, marginal people. Another aspect of that is we're seeing, our marginally housed population. For instance, in SROs, there are a few, remaining SROs in Oakland, for instance, but now the city is still trying to put in place a policy to regulate SRO conversion and to prevent that. But those are some of them are dumps, but those are sort of the housing of last resort for a lot of marginally housed or marginal people that maybe are elderly or are living on SSI, and that's basically what they afford. A lot of our county safety net clients, we place them in SROs. So that's another piece, I think, of the, what happens to the marginally housed population, is to look at that, the housing stock that does exist for that population, also under strain. One of the SROs in Oakland's been bought by a developer to turn into higher end, small units for students, right, or for tech workers. And then I think the last thing I'll add to that too is, that a lot in our county, a lot of our social service programs and mental health clinics or, substance use programs, a lot of them are located in the downtown or in the city center, and as people who were accessing those services are now not able to live in the city or are homeless or are commuting, that's a real concern for us, is to think about how do we, as a county safety net system, do our job, right, as a sort of the public, safety net in place that we do have, the strain that puts on that, and we're not reaching clients that are, or people that need those services that are, now in other counties, and where do the costs get pushed, right? And what are the costs in the receiving counties, right, that weren't set up for this, or didn't have, the access points or the services set up for this. And we're just starting to try to research that question more as a way to get to a broader regional solutions.
Thank you. One of the questions is about longitudinal studies that follow the health outcomes of people that have been pushed out. Are any of you aware of such studies of people following the displaced and what their health outcomes are? Yeah. So I will say that was sort of one of the reasons why we did this panel, was because there really is not a lot of literature on the displaced and what their health outcomes look like. So thank you for that question, and we hope that we'll be able to do more research to be able to answer that question in the next decade or so.
I think just to add one small thing, in part of our anti-displacement funding in our county, we've tacked onto it investments in data collection for the year following the end of the funding cycle, so that the providers will have to follow up with clients receiving services around anti-displacement or displacement prevention to see what, and we're developing those metrics now around not just staying housed, but what are other health indicators that we want to be able to track. So hopefully it'll be a stay tuned as well.
And then maybe if I could just add a methodological comment. So even in our research with the census, we're having participants use online diaries, and we're asking them, as they hear the gunshots or whatever is happening, to write about it, to take pictures, to do videos. And I think if anyone is going to engage in that type of longitudinal study, to have the participants really at the table, really as partners, and really documenting what's happening to them as they stay or as they go in the key areas. And again, to try to get these hidden processes that often get lost after time, or people don't ask, or it just doesn't come up, where you have to look at it inductively and see what's important.
Excellent, thank you. And this will be our last question, because unfortunately we're over time. So I think this is directed at you, Vicki. It says, in light of the Eastlake example, are project sponsors reconsidering their project performance metrics, who benefits, and then implications for community-based value capture and retention strategies? So I think this is perhaps alluding to ROI and what are the benefits of these types of investments.
So I'm going to say that the good news is that accountability is a wonderful thing. Nobody wants to start being held accountable, but I do think there's some real hope here. There are a lot of communities now using the tenets of collective impact that brings people together, and where you have shared data and measurement. The Harlem Children's Zone is actually one of those. And when you have the entire community who can see what is happening to education, what is happening to unemployment, what is happening for the things that are co-led with the community, these types of projects that, and there's lots and lots of those case studies now on the horizon. And so I do think there's some lessons learned. And for the Eastlake, after I read that blog, I spent all day Saturday writing to David Williams at Harvard and the Lancet First Authors and the Population Health Institute and everyone else and kind of let them know now that we do have the data, and to turn them around instead of being advocates for what happened in Eastlake, now that they can, in their positions of power. Jim Marks from Robert Wood Johnson Foundation got an email from me on Saturday. So I think that having panels like this and bringing forward these issues that you might not ever hear about, and just raising the awareness along with accepting that accountability. I do think we can change this, and that we're not going to have the same kind of horror stories going forward. So.
Yeah, thank you. Well, if you join me in thanking our speakers for this wonderful conversation. Thank you all. And thank all of you for coming. We really appreciate it. Please stay tuned to the Baker Institute website, part of our conversation today. And then after this event, for those of you who have been invited to participate in a small group session, please come right here in about 5 minutes or so. And those policy recommendations and the things that come out of this conference will be written up and posted on the Baker Institute website. So for those of you who are interested in continuing the conversation and perhaps, as Vicki said, more lessons learned as we move forward, you'll find information related to these issues on our website. Thank you all for coming.